now I would like to go back to EU-PROMENS. And I would like to give you a little bit of information on how we started with the development of the multidisciplinary training. As I told you, this is one of the components of EU-PROMENS. So we started with a needs assessment, and in this slide you'll see the overview of the methods that we have adopted for the needs assessment. Because we really wanted to gain an understanding of the existing training. So we started with a desktop review, and we collected information on what was available. In addition, we also conducted a literature review. And based on the results of the literature review, we had developed a guide for focus group discussions with a variety of professionals, and also to conduct interviews. Finally, we conducted a survey, which was also part of the whole study, to really gain insight into the most important competencies that we had to address during the training. So this was in a nutshell, but you can imagine that, of course, this was a huge piece of work. And we took also some time to conduct this needs assessment, but to give you a little bit of insights. So the literature study that we conducted, for the analysis, we included 60 relevant studies. We conducted in total 61 individual interviews, and also we organized focus group discussions with 35 participants. And of course, we included various participants from the different eligible countries for EU-PROMENS. And we had 287 responses also from participants on the survey. So once again, in here, just very shortly, something on the results that we found. So the trainings that we could find, they demonstrated very successful strategies, but we found that they were often very limited in their scope, and they focused on single disciplines rather than fostering this cross-sectoral collaboration. So we found a strong alignment across the different data sources on the importance of the foundational helping skills, mental health literacy, collaboration, and also multidisciplinary competencies. We also found that these foundational mental health competencies are really essential for all the different target groups. There was a specific need for culture and diversity awareness, but also there was a specific need for communication and empathy. Last but not least, we found that there was a need for self-care and resilience, also once again for all the different target groups.
And here is my part. So let me introduce myself. I hope you can hear me and you can see me. I am Vitaly Klinchuk. I serve as a mental health specialist in the project, in the EU project. And I will present a bit our not a final product, but our kind of main methodological and theoretical framework, which we now using to give a life to our training, which we used to give a life to our training, because training now is it's a process of rollout and piloting. So based on all this literature review and interviews and focus groups and surveys and desktop reviews, we manage to triangulate this three-tiered competency, cross-sectoral mental health competency framework. As a first tier, there are foundational mental health competencies. Those competencies that are relevant for all professionals who, even if they do not specialize in mental health, they are relevant to all professionals who are working with people, who work in supporting people. Like it's not just, but there are social workers, healthcare professionals of different specializations, and workers in justice system, etc. But there are also a lot of other types of professionals who are working with people. You can imagine that's a police, that's a workers from occupation centers and job support seeking center, etc., etc. So there are a lot of those professionals who are in need of those foundational mental health competencies. We will describe all of these competencies a bit later in a few minutes. Then there is a second tier that is intersectoral mental health collaboration communication competencies. Those competencies are needed for those professionals who are involved in those cross-sectoral collaboration, who should be involved in this cross-sectoral collaboration. So we are speaking here directly about education, social services, healthcare, justice, those people who should collaborate, those professionals, those services who should collaborate between themselves while supporting people in need. Different need, not just mental health need again, but also social need and education need and etc. etc. And there is a third tier. It is a multidisciplinary team collaboration competencies. Those competencies are required for those who are working within multidisciplinary teams, who are working within some services like mental health team, mobile teams, FACT teams, and all other kind of different configurations and models of teams which are available all across Europe and actually not just across Europe. So if we will try to dive deep, we will see that among foundational mental health competencies, there are, for example, foundational helping skills. That skills which we found out are already a list of those skills and model of the skills already developed, and we included them in our model. That's UNICEF WHO EQUIP model of competencies. It encompasses communication, active listening, empathy, confidentiality, building connection with people. And there is a list of 15 different competencies which are already tested, and they are kind of evidence-based and widely implemented right now, mostly in humanitarian context. But what we see, they are needed not just in humanitarian emergency context, they are needed everywhere. Then we find out there is a need in culture in diversity awareness, that sensitivity to culture, age, gender diversity, and all other kind of things which are important right now when the Europe is becoming more and more diverse and values diversity more and more. Then there is the mental health literacy, actually understanding what is mental health, understanding what are the determinants, factors of mental health, what would be the consequences of good and ill mental health, etc. There are mental health problems and risk assessment. We're speaking about understanding what are the signs of mental health issues, what is the risk related to self-harm, suicide, etc. How can we understand those risks? There is evidence-informed impact. It is about different type of impact which we can make at our workplace, starting from psychoeducation and psychological support, mental health promotion, activities to reduce stigma, but not limited. There are a lot of other different interventions which different professionals can implement within their work frame. Definitely, there is competency which is needed for everybody. That's a self-care and care of colleagues. It's about preventing burnout. It's about supporting other people at your workplace. And it's also about organizational framework which support people's well-being. And there is another competency which we include here. It's a support in recovery. It's those developing those attitudes towards people with mental health problems, attitudes related to respecting the dignity, respecting the self-determination, and respecting the growth through personal experience. So that's those foundational mental health competencies which are needed for everyone. Then there is a tier number 2, intersectoral mental health collaboration communication competencies. And here we speak in actually, no, here we have not so many, we have just 4, but nonetheless very important. We are speaking about navigating support and care system, understanding who is there outside of my sector, outside of my services. This competency encompasses not just understanding who is there, who are there around, but also skills on how to find those people, those professionals, those services around them in my community, in my city, in my town, in my country, to make them, we are moving to the second competency, to make safe referral and help person to navigate those services. Because there is another issue. It's okay to know, it's a very, very nice and very fine to know which services are out there, but and also it's very nice to transfer this knowledge to people in need. But sometimes our system is our systems are too complex. Maybe they're not so complex, but they are sometimes fragmented and they're not so easy to navigate. So sometimes we need to help person to navigate those services and to help them move through these labyrinths of different things. And then there is a collaboration across sectors. Actually, competency on how can we collaborate between each other, how social service can collaborate with community mental health center, how they can ensure, for example, altogether employment of people with mental health problems, how can they collaborate with justice system, etc. And there is service development support. It's this competency that's very interesting competency. I love it. It is about how if some service already progressed to some level of understanding and accepting that mental health is important, and how the service can also support other services around. How mental health center, community-based mental health center can go communicate with social services and increase their knowledge on mental health and need for collaboration. How social services can collaborate with in terms of mental health and support, for example, police, local police department in understanding of mental health. So that's this, here we have this service development support competency. And there is a third level. This level is not invented by us completely. Again, we used already developed framework, which we found out very useful and also elaborated. It is a Sunnybrook health team collaboration competencies. And here we have intra-team communication. Here we have conflict resolution, shared decision-making, reflection, role clarification, and interprofessional values and ethics. So that's is about competencies. And if you have any questions, post them in the chat or just keep them till the end of our till the final Q&A session. Right now, before we'll move forward to describing the training itself, I proudly and gratefully share the news that we did our first pilot last week. That's why actually we are doing this webinar right now, because we have something to share. Last week we went with team of Cornelia and with Mika and with Foska, our huge support in terms of administration. We went to Croatia, and with help of our Croatian hub, with Martina Rojnic as national coordinator, we managed to conduct our first pilot of this training. And right now, I want to invite those people, those professionals who were at the training to step in and just share a few words before we will dive into the training ideas, concepts, structure, etc. So this is a bit of emotional part. So guys, if you are there, those who were at the training, just turn on your camera, your microphone, and say a few words about your experience, how it was for you, what were the lessons learned, whatever. I see Dragana, Marina, for example, you turned off camera, please go on.
Hello to everybody. I just joined, so as Vitaly requested me, I will say a couple of words about how was my experience at the training at Trakošćan. I must say I enjoyed it very much. It was a very great approach by the educators. It was very relaxing, but we learned a lot in those 3 days. For me, coming from judicial system, in first 2 days I was the only one. Later, the third day, the 2 colleagues from probation joined. It was very educational in the way that I connected with the colleagues from other cities, from Rijeka, Zagreb, Pula, Osijek, and heard about the projects and programs with regard to mental health in their cities. And I've been able to see whether those programs and projects are something for our country and our city, as we miss similar ideas. I must say that I'm working in the county courts, and the majority of people coming in our office for victims of criminal acts are people with mental issues, and often also with psychiatric diagnosis. They are either victims or the accused, also battling with addictions, often with alcohol, drugs, or gambling, and often with them come also the family members who also need support and referrals to mental health institutions or NGOs. And for me, it's very important to know how I can help these people and where they can find the adequate help and assistance. For me personally, it was great to hear also from coordinator in Croatia what is the program and action plan up to 2030 in Croatia, and the idea of mobile teams throughout of Croatia is something that was very comforting to hear, because that's what also one of the aspects we need in our country. But as I said, the educators had a very great approach with the case studies, and all of us in our little teams could participate and tell from our perspective what can we do for those people with mental health issue problems, and then exchange the experience with other groups. And also what helped me is to hear how we can protect ourselves in the system, to be able to be professionals and to take self-care of us personally. So I don't know whether I can tell you even more about it, but for me it was a very valuable experience, and it was like on the level of Republic of Croatia, but it would be also great to hear from other participants throughout European Union what is their abilities in their countries and how they can help those people with mental issues, problems, to improve their mental health. And what was also valuable to me was to hear that even those small things that we can do in our sectors and with our connections throughout other people in the sector, how we can help them. So it doesn't need to be like great projects. We can start with the small things that help me a lot. And I've been able also this week to connect with the other colleagues in other cities, and also with the Ministry of Justice to tell the colleagues, and I will write a summary of the training and try to bring the ideas I heard there and about improvement of our departments in the courts with regard to those people needing our help, referring them to those professionals who can help them further. Thank you.
Thank you. Thank you, Marina. Thank you, Marina, for being here, there, and here, and giving the feedback. Katerina?
Hi, can you hear me?
Hi. Yes, yes.
Okay. Hi, everyone. My name is Katarina. I work in the Academy of Social Welfare in Croatia. It's an institution that provides professional development for workers in the field of social welfare. For me, this was also very, very valuable experience. I got to meet beautiful people, both the trainers and the colleagues from all over Croatia. I didn't join this meeting from the beginning, so I'm not sure what all the topics were covered, but I will try to summarize it from my perspective. I participated in the core training of this entire training program. So I think it covers the first two frameworks that Vitaly was talking about. It was a great experience because we got to work in very, very small groups and discussing case studies, which was it was a great way to dive deep into someone's story on different levels, because as we got through different modules of this training, the case studies gradually built up, and we got more and more information about the people we were discussing. We were in the small groups, there were professionals from various sectors. So each one of us gave their own perspective and their own way and approach to navigating through the services and how to actually help the people in need we were discussing. So it was a great way for us both to get to know our own roles, but also different roles from other professionals in different sectors, and what we all can do when we communicate, when we all participate, and when we rely on each other. Because I think the main point of this training program was to kind of realize that we are not alone in this. There are various professionals who are here to help people with mental health problems, and we need to rely on each other and to communicate with each other to try to help those people in need, because we are there for them. They're the most important here. We need to collaborate in order to help them to navigate this very, very complex system, especially people in need who maybe, I don't know, maybe they have a lower education. Sometimes it's children, sometimes it's elderly people. And sometimes we forget that it's a living human being in front of us. We sometimes approach it from the perspective, okay, it's just another case, it's just another day at work, and we sometimes forget it's living, breathing people in front of us. We kind of realize that even we as professionals who work as a part of this system, these services, don't know all of the possibilities we have in our own sector and also in other sectors. So this was primarily an extremely valuable experience to get to know each other all throughout the sectors in our own country. But as Dragana mentioned, it would be a very valuable experience also to, expand and see how other countries in the European Union also have this, handle this. So I think what we all learned here actually is how we complement each other, and how we should all work together to actually help these people. And I would also like to use this opportunity to help the trainers. They're great people. They approached us very humanely. They took care of us. They They checked our energy levels and played music for us. It was very relaxing, but it was also a very valuable work, and I would like to thank them and this entire project. And I would like to invite everyone, if you are having second thoughts or doubts, don't just join. I think you can really take something from this, both as a personal from personal perspective as a human being, and also as a professional to help the people that we actually work for. Okay, that's it.
Thank you. Thank you. Thank you. I do not see other people from Croatia. If you are here, just step in. We have a few minutes. Okay. Okay. Thank you. Thank you for being here, and thank you for being able to share your experience. Thank you for your kind words. It was very heartwarming, and I continue slide sharing and give word to the next speaker.
Okay. Oh, yeah, Janine.
No, please go ahead. I was just wondering if I could hear you, but yes, we can perfectly.
Yes, you can hear me?
Yes.
Okay, perfect. Thank you, everyone. I'm Fiamma Rob. I'm also a clinical psychologist and education expert for GFA and for the project. And I will take you through the training based on everything that my colleagues Janine and Vitali already presented. So the organization of the training, how we do this, I think it's really special in the way that we support our hubs and the trainers the local trainers and the community as such for the country with a pre-workshop where we have information that we give about the training. It's like about 2 hours. It's to service providers with professional experiences and participants from the non-healthcare profession background, participants from the core contact group, and everyone who is interested to learn more about this. And that's any time before the training starts. And then we have different training groups. There are more or less around 20 people. And then we start with 2 days of a core training. Those are the competencies that we saw from the pyramid, the first 2. And we will go into this in a minute as well. And then in these 2 days, which are the core trainings, it can be on site, it can be hybrid or online. I think the most valuable, obviously, always is when you're on site, you're all together. That's what Vitali and Katarina and Dragana or Marina talked about. This is where the magic happens. That's where people get to know each other. And I think not only learn about all the competencies, but really learn about the multidisciplinary approach, which is kind of a way of working, a way of living, I would even say, how you manage your everyday work life, and also make or establish these links within your country, within your city. I think this is the most valuable part as well in the training, because you get to know your colleagues and with whom you are collaborating. And then this is all cross-sectorally, so everything that my colleagues before talked about. And then we have the advanced training, which is 1 day, again in the same format possible, and also just in the same way as the 2 core trainings, but it's more specialized, more for mental health, And yeah, so this is kind of the three in total are a round and sound training program, but both the 2 days and the 1 day in themselves are complete. So whether you join one or both, you will get the most out of it. And then at the end, we have a workshop again. And again, 2 hours with feedback and really understanding how everything worked and went, and just collecting the invaluable things that you might not get to know when you're in action, but then in the feedback you will receive all the information how to make it better, and just to hear how everything went. Thank you. Next slide. The target groups, Vitaly already spoke about them as well shortly. We have health professionals. Those are any professionals working in medical and allied health workers, for example, general practitioners, nurses, and so on. This can look differently in different countries. We have 30 countries, so the systems work all differently, but you have health professionals, and they cover different areas in each country. So then mental health professionals, psychiatrists, psychologists, counselors, and therapists, and however that looks like in each countries. Then social work professionals, practitioners working in social care settings. We have the justice sector workers, professionals in the justice system, juvenile detention centers, and law enforcement. We have education workers. Those are all covering education realm, like teachers, school counselors, and educational administrators. We have non-clinical mental health professionals, so peer support workers, community volunteers, and others. We see actually with the non-specialist helpers that more and more people are needed in those capacities. And so it's really, really important that the basic competencies and levels are met there. And then cross-sectoral professionals, individuals working in interdisciplinary community settings. Yeah, so coming to the core training modules, it is actually really exciting because it's all really based on the hard work that Janine and Vitaly presented already before. It is really not coming out of theory, it's really coming out from the professionals themselves. So of course we looked at the different frameworks, but the modules really are looking at what is needed now. Through the key informant interviews, we did very in-depth analysis that we already talked about. And I'm just mentioning this again because I think the strength of this training is that it's so practical and so close to the heart of what people asked us to, and what is needed in their work situations. And I think that's very special. It's very rare that you get so much input from such a multidisciplinary realm, and to then integrate this into a training. I think that's one of the biggest strengths that this training is offering. And so in day 1 for the core training, we have module 1, introductions and setting the stage for mental health needs and gaps, really to understand everything around that. Module 2, multidisciplinary approach and foundational helping skills. Module 3, mental health literacy and understanding risk factors. Module 4, risk assessment and roles in early intervention. And then in day 2, we look at module 5, navigating wider support and care systems. Module 6, referring and helping individuals navigating the services. Module 7, collaborating with professionals across sectors. And then module 8, final reflection and application and participants' workplaces. You see that we have selective modules, culture and diversity awareness, making evidence-informed impact, supporting recovery, interprofessional values and ethics. And you might be thinking, how can these be selective modules? They are all so important, and maybe even the most important, because this is really where the human person, what Katarina was mentioning earlier, sometimes we maybe forget that we have a human being in front of us. Yeah, we see a case and symptoms and everything, but the human behind it. And that's what these topics really look at as well. But I think the good news is first of all, each country can decide which modules will be taken. So you can choose, pick and choose, so to speak, what is most relevant for the country context. And then I think the second good news about this is culture and diversity awareness, making evidence-informed impact, supporting recovery, and interprofessional values and ethics really are mainstreamed throughout every module. So you cannot discuss a multidisciplinary approach and foundational helping skills without touching all of those topics. So you might not go into the deepest depth, let's say, of a module if you didn't choose it. But the good news is you will definitely talk about it in the modules, but just because it is really interwoven into all modules already. And secondly, and I will talk about this in a bit, we have cases, which are the heart of our training. This is another, I think, a special point for our training, is that we are really looking at how to make impact really already at training level. How can you do this multidisciplinary approach at training level? We're not keeping it at theory level. And I think that's where, again, the magic happens and the real work starts, where you start thinking as well and collaborating already. Okay, so this is about the core training, and about the cases I'll speak in a bit. So the advanced training modules are 4, and again, we have selective modules as well. So the first module is EU Comprehensive Approach to Mental Health. Then the second module is Multidisciplinary Collaboration in Prevention and Promotion. Module 3 is Integrated Mental Health Support, Treatment and Recovery. And module 4 is Self-Care, Team Wellbeing, and Workplace Mental Health Strategies. And then selective modules are support the development of other services, collaborate, communicate with professionals of their team, interprofessional conflict resolution, and role clarification. And I think, again, as I said, for the core training modules, the selective modules are also topics that will come up during the discussions. And so even if they're not selected, they will come up as well. But again, each country has the opportunity to choose the modules and the topics that are most relevant for their country, which makes it the most relevant training possible for the context. And I would say also self-care, team well-being, and workplace mental health strategies also is looked at automatically during the core training, even if it's not mentioned explicitly, because that is also the foundation and the basis how we can actually deliver training in an effective, safe, and human and empathetic way. So these topics will come up as well during the core training in case people are not also coming to it advanced. So the starting point are the cases. Those are really so dear to my heart, because I think that's what also makes our training so special, as I said before. Those cases are really kind of living cases. When you read them, you have the feeling the person is in the room with you. And those cases, as the 2 participants also mentioned, they are like always a thread that comes back all the time, like a red line that kind of connects all the training components. As you might remember, we have 17 competencies in the framework. And for each competency, we developed different cases that are relevant for the context. So we choose, for example, here we chose 2 cases that training participants could look at and then work. And with work, I really mean interdisciplinary and multidisciplinary work in role playing. So this is where it gets a lot of fun, looking at how you could actually work as a multidisciplinary team on a case. So for example, if you have a case, for example, Maria, a 16-year-old high school student who has been referred to the school counselor due to symptoms of depression, and then you have like all the background for that person. And then what we did was a case evolution layer per competency. And in addition, competency-based guiding questions per competency. So for example, you always start with a general guiding question, how can we across our different roles and professions, for example, work together to ensure that in this case, Maria would receive timely and sensitive and appropriate support that considers both her mental health needs and her environment. So you already have a very vibrant question that kind of introduces you into the case. And then per competency, and that's what was mentioned before by the participants, bit by bit, you receive more information. So for example, for foundational helping skills, which is one competency, you would get 2-3 sentences or like one small paragraph of information more about Maria. And then again, a guiding question, how you could work with this. And then again, you get for culture and diversity awareness, you get more information about Maria. And so as you can see, we have 17 competencies. So for one case, even though you might not have a selective module on, for example, culture and diversity awareness, you will actually have it within the case because the information is given by layer, by each competency. So you have such a rich case in the end, which then all the different professionals will then work at and in a role play, discuss and work through how they can support, in this case, for example, Maria, and how best to go about it. So I think that it's such a in-depth and really, really fine-tuned information that you get per case. And the case is really the heart of the training as well, that I think it's a lot of fun, but also really real-world, deep quality training content, where after the training, whether you're in the core training or the advanced training or both, you will come out as a more, I would say, aware and curious professional that is open to collaborate across the different professions and target groups. And I think the participants are then also more equipped to do a better job at their job because they just have a wider support system as well. Because as professionals, we need also a support system and have maybe an extra pair of eyes to look at a case who is a human. Yeah, thank you. Yeah, so our training is really next to the cases and everything that we discussed already, is highly adaptable, and it's basically after you have the needs assessment, you look at what is the audience and the problems, and you adjust by the cases. So for example, you see which case is most relevant for the country. If, for example, we have 11 cases, there is a case that is needed, an extra case, we develop it as well for the country so that it's really the most pertinent, the most relevant case and information that people get for their context. You adjust the modules and the competencies also based on what is relevant for the country. And then you have also an adjustment for the presentations and the content where you look at the country and the community level. And I think having these 3 levels of flexibility and adaptability makes it really as relevant as possible for the country and really close to the everyday issues and problems that professionals are facing in their work environment. And I think that is it. Thank you very much.
Thank you. Thank you. And I guess it is time to stop sharing the screen and have a time for discussion. I can moderate a bit. We can turn our camera. See you now. And I will go through first of all, there are questions in the chat. I will go through them. I will try to understand who is a key focal point for the question. So the question is, I think this question is to Chiara. Good morning. My question is about collecting an overview on all the trainings done through the flagships. Is this eventually planned in the next tracking framework? Now, Chiara, if you with us, I guess that's a question for you. Otherwise, I don't know. In our project, definitely. Then there is a proposal to take a look at the, I guess it's a proposal for Croatia, for Marina. Marina Dragana, that's for you take a look at the KU Leuven Criminology Institute and the online education platform on trauma-informed practice. That's for Croatia and there is a question from Joanna Latala. Hi everyone, thank you for this session. I am founder of a platform called EU-PROMENS Mindset, which supports mental health well-being of performers. I'd love to ask if there is a possibility to join or collaborate with the program you are presenting here, and if so, how could we get involved? This question is marked by 3 hearts. That means a lot of people are also supporting this question. So probably Janine.
Thank you, Vitaly. No, and thank you for this question, Joanna. I am not aware about the platform you're the founder of, but of course we can always have a meeting and to talk with each other what we are doing, and then we can always explore opportunities for how to see if we can strengthen each other or if we can collaborate each other. But to be honest, I don't know how to answer yet, but I think we can always set up a meeting so we can meet each other.
Yeah, what also can be done, you can also subscribe to our newsletters and get informed about training in your country, which definitely will be also have. Which country you are in?
I represent Sweden and Poland.
Sweden. Oh, we will be there. Definitely, the training will be conducted in Sweden and Poland. Definitely next year, I think. Next year. Also, meanwhile, you can check our exchange program. And Thursday there will be a webinar about exchange program you can attend. And for now, we have 3 hubs open for registration, and you can register for exchange program, for example. And there are 3 countries opened for the exchange which will be in autumn. So you also can do it as well. That's kind of the simplest steps, even before conversation and meeting.
Okay, great, thank you.
And also during our talk, I had a short chat with one of the participants from Croatia. She was not able to join and to speak because of technical issue. But if you are here now and you can step in, there is also time for a few words again from Croatia about the training.
Hello everyone, can you hear me?
Yes.
Oh, great. I had some technical difficulties. First, hello to everyone. So I participated in your seminar last week in near Varaždin County in Croatia. Participating in the seminar on mental health, it was highly valuable and professionally enriching experience. I can say from I have 20 years of experience in the field of disability assessment, evaluation of functional capacities. I worked with all the marginalized and vulnerable populations. I worked in domestic violence. I worked in prison with juvenile correction facilities. And I found the best seminar I have ever attended. Why? It was relevant and impactful because we were all together, people from different mental health settings. The opportunity to engage in such meaningful dialogue and cross-sectoral collaboration underscored the importance of an integrated multidisciplinary approach to mental health, the diversity of perspectives that we shared during that event enhanced the quality of discussions, and it reaffirmed the need for continued cooperation between professionals from various sectors, not just from various sectors, but from various countries. It is a great opportunity to have to collaborate with people from different organizations from different countries, and I'm very grateful to have been a part of such a well-organized and significant initiative. And thank you very much, Vitaly.
Thank
for
you.
everything.
Thank you. Thank you. Thank you. Thank you. Thank you for your words. If there are some other questions, you can turn on your mic and just ask. Just also remind you, if you're thinking about exchange program as well, all expenses will be covered for you, so you don't need to pay for anything. No, you have, if you want to buy something to drink in terms of not just the water, but something else. For this, since you pay for yourself.
Vitaly, I think there's one more question from
Okay, checking.
Nita, I think, on the conclusive workshop.
Referring to Joanna's question, on the same note, is it possible to get more info on the conclusive workshop? This question from Hungary. So conclusive workshops, Fiamma, maybe you already addressed this topic, maybe you can step in.
Yeah, I mean, I don't know what more information you would like to receive, but I think the workshops are there to receive additional feedback, how the training went, what are things that could be improved as well. Is there any further information that participants need? I mean, any further engagement with service users and others that that could be valuable to the country, just to have a well-rounded close-up for that country, or any next steps that want to be taken by the country as a whole, or the professionals, or where we can support. I don't know, Vitaly, Janine, if you want to add anything.
Yeah, just at the moment we didn't have exclusive workshops yet, because we just started the piloting. We had opening workshop in Croatia. We will have opening workshop today, I think, in Spain. In Spain, and so there's two countries from which we are starting. And in Croatia, we will have conclusive workshop in, I guess, in September. We will finish piloting, and then we will have conclusive workshop maybe somewhere in October. And the same goes to other countries. In Hungary, we definitely will be in Hungary, but in Hungary we will be a bit later. I think it's also planned for 2026. So it all starts with intro workshop for stakeholder engagement, for better kind of visibility, and also informing local authorities, local and national, etc. And then training, and then we do final workshop with same participants, but also with training participants to have, it's kind of mini conference maybe, but just online, to share experience, to collect lessons learned, and also do some planning for the future. There is another question from Hannah. Hannah, you can just turn on mic.
Hello, everyone. I took part in the Croatia exchange at the end of last year. So it was amazing, and I want to thank you, everyone, for your amazing job. And you are for me like dream workers and dream company. Right now I'm based in Hamburg in Germany, and I was presented from participants from Germany and also from Ukraine. So I'm wondering if you have any open positions in your company. So maybe I can contact with someone who is working with these questions.
Oh, well. Janine, you are as deputy.
Well, thank you for your very kind words. I think you can always drop me a mail, and then I can forward it to the right person in the organization, because well, we all work for EU-PROMENS, but of course for GFA. But yeah, I can always forward your mail to the person I know in GFA who can support you in this.
Okay, thank you so much.
Yeah. Also, actually, there is a opening in Mental Health Europe. They're looking for mental health policy officer, as they advertised this info just a few days ago. So you can go to the Mental Health Europe website, check. That's online. That's kind of work from on this kind of distance work, but nonetheless. Also on GFA website, you can go and there is, I think there was an option earlier to just drop your CV as it will be included kind of into the database. So that's also possible because GFI also has a lot of different projects, different areas. Yeah.
Okay, great. Thank you so much.
Yeah, but that's very nice. It's a very bold approach. I second you.
That's true. And I think we will also share this with our organization, that it was called the Dream Organization. That's nice to hear as well, I think, for the people that work there.
There is Chiara, you can step in definitely. That also was question to Chiara. As was question to Chiara, Chiara, can you?
Yes, here I am.
Yeah, yes, there is a question to you. The question is, how can I contact you about more information about EU for Health? So probably you can just give.
Yes, of course. Thank you, Joanna, for the question. So basically, in the presentation I gave, you have also a link to EU for Health program. So there is a program. Otherwise, well, you can also drop me an email, and if you want more information about the program, I can also provide you with some links or public pages where you can learn more about what is EU for Health. So I don't know if you have my email. I can type it here, maybe, if you want.
Yes, you can.
Yeah, I type it in the chat.
And while you're here, there's another question to you as well. Question is about collecting overview on all the training done through the flagships. Is this eventually planned in the next tracking framework?
Okay. Sorry, I don't see this question. Is it in the chat?
It was in the chat.
Very first
at the beginning.
one of the first. Or the second one, actually. The
thank you.
Question. Yeah, from Ildiko.
Collecting over training flagship traumatic.
No. It's,
no.
I will copy. I will copy.
Oh, thank you, because
I
I'm going through all the questions.
Yeah.
So basically, so the tracking. Thank you so much. So the tracking framework is monitored by DG Sante, because so we have 29 flagship initiatives. EU-PROMENS is one of these. So DG Sante is progressively tracking the progression across these 29 initiatives. And this is an exercise that they do sort of internally, but of course in the public health experts group, in the health policy platform. So they have to also report on this tracking. It's not just, it is of course an internal exercise, but then it has to be reported to the public. So yes, I'm constantly in contact with them. And if you want to know how this reporting of this framework and tracking mechanism, I can tell you more. So I can note down this question and maybe reply to you in writing so that you know where to see progression across the 29 flagship initiatives. Okay.
Perfect. Thank you. Thank you.
Yeah.
Okay, we have a new question regarding the training program. I checked the schedule. It will take place in December this year in Portugal. Is there any information available on dates and location? We have actually Dora here. Do you know if you know something about the dates and time? But I guess the general answer is please subscribe to our newsletters and you will be informed in due time, because we are not there yet in terms of exact planning, because we will do this exact planning for rollout a bit later. Right now we are on the piloting stage. So just subscribe to the news and just wait a bit. But maybe Dora, if you're here, if you know some news or maybe some information, something more. Okay.
Maybe
Tom?
I can answer, Vitaly.
Yes.
At the moment, we are doing the piloting in the 6 hub countries, and after the piloting ending in September, we will do the evaluation and maybe, if necessary, different modifications of the program, and then we will start with the rollout. And all what you see at the moment with dates and estimated month when to implement the training is not more than a planned status, and it's changing from time to time. So also from my side, the recommendation, please subscribe for the newsletter, or and this is the best way to be updated and informed always with the coming events in our fantastic project. Yeah.
Thank you. Thank you, Tom. So we have 4 minutes left. No questions yet. So maybe Janine, some final words.
Thank you, Vitaly. No, I really would like to thank you for your participation and for your attention. I can imagine that it was a lot of information about the project and also about the training, but we really try to give you the basic information that is needed to gain understanding of what we are currently doing in the pilot phase. And as Tom mentioned, we will evaluate the pilot trainings in the 6 different hubs, and thereafter we will roll out in the other countries. Please subscribe to our newsletter, because indeed via the newsletter we will inform you once we really have the confirmed dates, not only for the training but also, for example, for registration for the exchange visits. We are still planning for the visits as well. And I also would like to ask you, please share the news on EU-PROMENS within your network, because that also will help us, of course, to reach out to potential participants, but also to reach out to potential partners for the rollout. And please, you will find more information on the website of EU-PROMENS that Vitaly has also shared in the chat. Well, if you have any remaining questions that might pop up, please do not hesitate and reach out to us via the mail. We're more than happy to give you an answer to the questions that you have, or maybe we can have future collaborations. That's always very good in this field. So I really hope you enjoyed the webinar. Thank you once again for your attention, and I hope you have a lovely day.